Okay, let's talk specifically about aerobic activity when you are dealing with cancer. So, how often do you need to do aerobic activity? So, we're going to kind of spell out what aerobic activity really helps with. And sometimes that may want to be your main focus, and that may be all you can do. It would be great if you can combine the cardiovascular and the strengthening together. Then you can kind of back off a little bit on the cardio as you're increasing that strength. So, 3 to 5 days a week of cardiovascular activity is what you want to do with cancer. You want to do fairly light to somewhat hard. So, what does that mean? You don't need to be running. If that's not what you did before, if you did that before, great, run. But it's not something that you have to do high intensity. So, this is going to be light to moderate. Start with a few minutes if that's all you have, and gradually build to a total of 30 to 60 minutes most days. So you can break that up into 5 minute increments, 2 minute increments, whatever you are. You're going to start where you are and you're going to do what you can. And some days, depending on your treatment, you may not be able to do that. But that's how you're going to start your aerobic activity. If you have peripheral neuropathy from your chemo, be very careful in walking on treadmills. Make sure that you use the handrails because you may not be able to feel your feet and your balance may be off and you may not even be aware of it, and we don't want you to fall. So make sure that you're holding on to the handrails. If you are at increased risk of infection or irritated skin, you may want to avoid the pool. Contact your physician especially if you've had any kind of surgery. Now is not the time probably to get in the pool if you have any open areas. Avoid exercise if you have an active infection, if you have a fever, if you just had surgery, if you have extreme fatigue or you're having difficulty, significant difficulty with walking. Make sure that you're contacting your physician again. So, also ask your doctor if you have received any type of heart damaging treatments because some of these treatments can affect your heart. So, you want to make sure that you're asking your doctor if you have received any of those treatments and if there's any precautions with your exercise.